Hey, it's me, Dr. Eric Potter again from Sanctuary Functional Medicine. I am a few minutes late. It looks like 6 or 7. I apologize. Hopefully have not kept you hanging in there too long, but I'm from Sanctuary Functional. We're in Franklin, Tennessee, and every couple of weeks we do Facebook Lives where we talk about different topics that may be affecting your health. So today's topic is going to be on autoimmune disease, where our body attacks itself. So before I get started, I just do want to make a couple points. One is I cannot diagnose, I cannot treat anyone in this format, even if you're my own patient. I want to talk to you directly about symptoms or questions. You can leave them and we can do education here, but for those that are not my patients, I do not want you to expect that I'm going to be able to recommend direct therapies. I can help you know where to look, potentially for possible ways that you could recover from illnesses, but without doing a history, without knowing you, physical exam, I'm not going to try to do something that's bad medicine. So with that in mind, I also want to say that if you are interested in seeing us after this or watching this later, you may come back and watch this at a later time, give us a call. We have some appointment openings left in December, the 615-815-5941. With that in mind, as I see several are coming online, we are going to get started just with a little bit of introduction about what autoimmunity is, and then I have a great list of questions here that many have left for me. So we are going to spend probably most of our time working through those, but we're going to start with some of the basics. So what is autoimmune disease? If you have it, you probably already have a decent idea, but for everyone, let's start with the basics. Autoimmune basically means your immune system, which is normally intended to take care of the bad guys trying to break into your body, those bad guys that may cause inflammation, they may cause tissue destruction, they may cause runny nose, they may cause GI symptoms. Our body's immune system are on the lookout. They're the police force, the security force, trying to keep those bad guys out. And we are constantly being bombarded by our environmental infections. There are bacteria floating around in the air. There are bacteria, yeast on our skin. There are viruses everywhere, and even inside us. Inside of our colons, there are tons of bacteria. There are billions of viruses. Now, a lot of those viruses are attacking bacteria themselves, but they're there. We have some yeast that are there. They're actually helpful. We probably all have at least a little bit of parasites in our gut, especially if we're doing any camping, we're interacting with nature at all, then we may be having some of those. So our body's defending outside, our skin, breathing in, our lungs, inside of us, in our guts. Anytime you eat food, you're trying to clean it with acid in your stomach, but there's still some bacteria that get through there. Or if you're trying to get probiotic foods, you're trying to get past that bacteria. But our immune system is trying to keep us healthy and away from things that might be trying to destroy us. With that, autoimmune disease is when that police force, that immune system, starts attacking self. Instead of attacking that bacteria coming in, it is attacking skin cells, lung cells, eye cells, kidney cells, liver cells, muscle cells, just about any tissue in our body, even our ligaments and tendons can be attacked. So when we look at different named diseases, those are just names given to syndromes where certain tissues are being attacked, but the ultimate process at the root of all of this is something's causing our tissues to be attacked. Now, the ways that they can be attacked is antibodies directly against those tissues can be made. Sometimes antibodies are attacking your ligaments. Sometimes they're attacking your heart cells. But also there can be other ways where you are having your tissues are kind of caught in the crossfire. It could be that it's binding some proteins in your bloodstream, but those proteins and the antibodies that are stuck together then get stuck in your small vessels, your little capillaries, the smallest blood vessels in your system, and start when they stick in tissue, it's actually those immune complexes, they're called, that trigger all the inflammation. Now, so we understand your immune system's gone haywire. At the same time, it's really a dysfunction of the immune system, and a lot of times those patients who have autoimmune diseases You think, oh, well, their immune system's really revved up, they shouldn't get infections. Actually, some of those get more infections because instead of spending their time, the immune system's time and energy killing off bad guys, they are actually attacking good guys, and the bad guys kind of sneak in, and you can have more infections. So we have to be careful, and some of the medicines that are used for patients with autoimmune disease end up suppressing, rightfully so, the immune system and allowing other infections to get in. Now, it's attacking your body in different ways: cells, antibodies, immune complexes. Why? Why would your body decide to do something so crazy as to attack itself? Well, that's called a trigger in functional medicine, something that happens back here at a point in time that sets a process in motion where it has downstream negative effects. So in terms of autoimmune disease, your body is responding to a lot of different threats from outside it. It's also responding to foods you eat. So you have antibodies against foods. You have antibodies, actually do have some tiny amount of antibodies to your own tissues floating around your blood, but for the most part, your thymus helps filter all those out. And when you eat foods, you don't typically react to them, although some do have immune dysfunction in that manner, in that form. However, with that, why is it that all of a sudden your body would start attacking friendly people and friendly tissues instead of foes? Well, those triggers can be molecular mimicry in terms of foods, in terms of infections you get that can trigger that. It can also be some toxins. Toxins can alter the immune system where they're more likely to start attacking friendly tissue. With that in mind, let's talk about the big three common ones. Foods, you've heard of gluten sensitivity, celiac, and how it can trigger inflammation in your gut. Gluten can then trigger also inflammation and rashes in the skin. It can also cause a variety of other symptoms, from brain inflammation to joint inflammation to putting someone at risk for a higher risk of heart disease because there's inflammation going on inside the blood vessels in the heart. So there's a lot of places where celiac disease can put someone at risk. So you reacted to gluten, and it causes you to cross-react with antibodies to other tissue and have those symptoms. So foods are a big one. I've had several patients where we've done some food testing or done some elimination diet and realized that's where it's causing it, whether it's a gluten is probably one of the more common ones. Dairy can be an issue, eggs, but just about any food can trigger those reactions. I've seen patients get bloody diarrhea from eating lettuce or cucumbers. So even something what you think is surely that could not cause that kind of allergy or that kind of a reaction. It's not really an allergy, but it's more of a immune reaction. You're like, anything's possible. So with that, we're looking for those triggers, and then you're like, well, why do people start reacting to foods in the first place? Well, one of the key things in that is probably leaky gut. Leaky gut means that rather than your cells in your intestines being nice and tight, the spaces are starting to open up, the tight junctions, due to zonulin or inflammation or histamine, and all of a sudden those proteins from foods you're eating that normally would just go right through, you digest, break down, and do great, all of a sudden those are breaking into your bloodstream, the walls of your intestines, and your body starts reacting and attacking, thinking, oh, here comes something, I need to prevent this. But what happens is then that starts triggering inflammation. Your body turns up antibodies to those foods, those proteins from those foods, and pretty soon then, if one of those antibodies reacting to, say, gluten happens to decide it's going to attack, not really decide, but another protein in your body similar to it, like say thyroid, which is a common thing for Hashimotos as a trigger, it may be that that antibody in the bloodstream then starts attacking thyroid tissue. And then, oh, you got plenty of thyroid, so instead of, even if you start eating gluten, that can keep going. Now, a lot of times we do see that when we remove those food triggers, someone's reaction stops, which is one of the great things, and one of the first places we look is one of the most common sources of triggers is foods. One of the easiest to correct, and one that will go away the easiest are foods. Now, the second thing we look for are toxins. So we want to see mercury, aluminum, You want to dysregulate an immune system, give someone aluminum or mercury. Also mold toxicity, something we deal with a whole lot in our office. We will see patients ANA, a test that most people think of in terms of lupus, but it is an autoimmune antibody of about 100 to 150 different potential antibodies. That will go up. You remove the mold toxicity, and I've seen it go completely away. So that is another thing, mold toxicity. The final group, and again, it's just your body gets dysregulated, starts attacking tissue it shouldn't, and that gets going from there. But if you can remove the trigger often, you can see that resolve. The last group is a little harder sometimes as we look for chronic infections or past infections. Coxsackie-B is a type of virus that is connected with type 1 diabetes. Also, there is some connections between the MMR vaccine and diabetes type 1, causing an autoimmune response to attack the pancreas. There's also EBV, Epstein Barr, can be another trigger. So there's a lot of different places in terms of infections we can look at. Chronic Lyme disease may do that as well. We treat that at our office. So we're looking at foods, toxins, and infections. Infections, sometimes they don't completely, the autoimmune part doesn't completely go away once you get rid of that infection, but we do try. We look across the board for all those things. So with that in mind, we understand what autoimmunity is, kind of some of the triggers for it, and I'm not going to get into, except with the questions, get into all the different names, some lupus, psoriasis, and all those things, but because we're going to approach it very similarly. We're going to look for the triggers, and then we're going to look how we can upregulate your body's healing mechanisms, whether it's downregulating NF-kappa B, upregulating NRF2, one of the main anti-inflammatory cascade pathways in our body, whether it's using things that downregulate COX-2 or LOX, which are some of the inflammatory pathways. So using things like curcumin, boswellia, omega-3s, alpha-lipoic acid, glutathione, other antioxidants. We're going to try to turn down that process, close up the leaky gut if we find it, remove those triggers if we find them, and over time see patients get better. So with that, let's jump into some questions. We've been going for a little bit now. Do want to remind you, I'm not going to try to diagnose, but I am going to try to educate. I want you to understand your health, and if you want more help where you do want diagnosis, we are available for new patients. So we have openings in December. So with that, let's just start from the top. We have Miss Grabowski, who was asking about getting hives diagnosed with Hashimotos. Any suggestions? She's not taking any thyroid meds right now. So Hashimotos is basically an autoimmune attack, typically either thyroglobulin or thyroperoxidase, two different types of proteins in the thyroid, where your body's attacking it. Thyroglobulin is what holds thyroid and hormone until you release it. Thyroperoxidase is one of the enzymes that helps you make your thyroid hormone in the first place. So if you're attacking either one of those, your thyroid both degenerates and can't do as good a job making thyroid hormone. So, and getting hives. Now, are hives just a side effect, or is it the fact that she's actually attacking her mast cells and her mast cells are releasing histamine? I don't know that for sure from just this short question, but I would look for those immune triggers. Is there something that has set this cascade, this train going down the hill? If we can find that, can we stop the train and turn it back up? So yes, I've seen thyroid antibodies go away when removing triggers. There's other times that we've gone through a ton of triggers and still see either those antibodies stay where they are or at least not get worse. So I can't make promises, but I can tell you I've seen removing triggers heal up the Hashimotos. And occasionally, if someone's caught early, get to the point where they don't necessarily need the thyroid medicines anymore. So with the hives, we would look at some other therapies, potentially like quercetin or their natural antihistamines. They can help prevent that, but again, we want to do functional medicine likes to look at root causes. If we can remove the root cause, often the downstream effects go away. So thank you for that question. The next one is from Miss Evans in Chattanooga. What's the most effective treatment for psoriasis? All my other autoimmune symptoms seem to be under control, but the psoriasis, especially on my scalp, is making me crazy. So psoriasis, for those of you who don't know what it is, if you have it, you know what it is because it is very frustrating. It is a skin disease where there's an overgrowth of the skin cells and a thickening. With that, it's an autoimmune triggered process. So the body's attacking those skin cells, causing a hyperproliferation, thickening, and then redness and inflammation comes with that. It causes a lot of itching, it causes a lot of discomfort. That skin, because it's not functioning well, is more likely to get infected. So not only will it be inflamed from autoimmune attack, it can also be infected, which then stirs up the inflammation even more. So if you have that on your scalp, it can be very uncomfortable and also embarrassing going out with a skin disease. You can have that anywhere on your body. We do know psoriasis can be triggered in many cases by different infections. The most common known one is strep. So you can have guttate, G-U-T-T-A-T-E, psoriasis, in which strep infections cause that little dots of psoriasis to worsen. So we know that's one place an infection is definitely a potential trigger. And a lot of patients who don't have a definite infection link will notice when they're sick, it overall worsens, even though it may be there between infections as well. So with that, we would look at potential triggers for that patient, kind of walk through a functional medicine approach, looking at the root causes, treating the whole person, lowering the inflammation in their body, helping them choose a low inflammatory diet. If they're eating a lot of sugar or a lot of trans fats, a lot of food coloring, dyes, preservatives, increasing inflammation, we're going to try to help them lower that, so at the very least their symptoms are less. If we can find triggers, we'll try to remove those triggers, whether it's treating Epstein Barr, whether it's treating chronic Lyme, whether it's treating chronic other viral infections. But then we'll also look at anti-inflammatories, whether that's using things like a sufficient dose of vitamin D, which modulates the immune system, whether that's looking at topical vitamin D analogs like calcipotriene, which is a pharmaceutical, looking at using fish oils to lower omega-3s to lower inflammation, and doing that both orally and topically. So those are some different ways. Again, we'd have to know a little bit more to be more specific, but those are definitely some things that we see benefit in for patients with autoimmune, whether it's psoriasis or other things. So let's move on to the next question. Ms. Parsons from Selmer, why does my inflammation always hit my hands first? Or that's where I can see the inflammation and feel it. My hands swell, get very dry and crack open. I can actually feel pockets of fluid in my knuckles. Very painful. I have MTHFR, PMT, CBS, COMT, SLC 1981, NOS3, ENOS, BCO1, FUT2, FADS1, APOE gene mutations. I'm just now learning about some of the things my body needs to reduce inflammation, but I am still very lost. So there is a few hours of lecture and discussion in that one question. So I'm going to try to cover it enough that there's at least an answer to get Ms. Parsons started, but we will work through this piece by piece. So why does the inflammation hit our hands first? So when there's a trigger, there's often one particular tissue that's more hit by an autoimmune disease. So lupus is known for certain places, particularly kidneys, skin, soft tissue. Rheumatoid arthritis hits the joints more, so it's hitting more the synovium, the pocket of fluid-producing tissue around your joints that allows you to have lubricated joints. You'll see patients with autoimmune vitiligo where they're losing the skin color in their skin. Only certain parts of the body. You think, oh, why is it not attacking everywhere? It's often only certain tissues. If it's the nerves, it may be only one nerve that's attacked rather than all the nerves in the body or a certain part of the brain. So with that, it may be where there's more damage, so more tissue is exposed because, say, you have wear and tear arthritis in your hands. There's more of that tissue that the body can then react to, and once it's stirred up, it can't heal over to protect those tissues again. So, and then feeling pockets of fluid in the knuckles, that's just because those are building up as inflammation oozes fluid out. All of a sudden you have fluid in tissues that normally should not have it there. Then she goes through a number of genes. Rather than going to every specific one here, I will say this is something we do deal with a lot in looking at someone's genetics. We are using things like MTHFR, PMT to determine whether or not someone has risk factors. They are not genetic diseases, say like sickle cell, where you either do or do not have it. It's more of a dimmer switch. So MTHFR may make you more likely to get something, or PMT, for example, has to do with you making choline, which you need for your nerve cells. All your cells in your body need phosphatidylcholine. If you don't have PMT working well, you may not have healthy nerves or healthy cells in general. So we'll look at those things and then look at the person, look at some functional testing to see how their metabolism is functioning, how the immune system is functioning, to determine whether or not those genetics are playing a part. Sometimes those genetics are, and we would say they're expressing themselves in that person's illness. At other times, it's not really doing anything. It's just not really affecting. So we've got to discern which of those two cases it is. So with that, for Ms. Parsons, again, we want to look for those triggers, those underlying root causes. We'd want to address any potential physical trauma that she's had. Maybe that's where, like I said, where it started it. We would use the natural anti-inflammatories that we've talked about, whether it's curcumin, boswellia, quercetin. If someone's having some histamine issues, we may use that to lower leaky gut, lower inflammation, and leaky brain is a possibility. So there's a lot of things that we would be able to do. Optimize healing, lower inflammatory diet factors, and try to help a patient like that. So let's look at, so let's look at the next question. Miss Gerard, I've been diagnosed with psoriatic arthritis, probably brought on by trauma to my legs 2 years ago. Taking medication prescribed by arthritis specialists, methotrexate injection weekly, sulfasalazine and naproxen to control the swelling and stiffness. Never taken a lot of medications historically, and I feel tired and have trouble focusing. Are there natural options for things I can do to eliminate the heavy medication? Yes. So let's back up. Psoriatic arthritis. We talked about psoriasis earlier. That's when it's affecting the skin. Psoriasis can also cause inflammation in the joints. So a lot of psoriasis patients can have horrendous joint inflammation, debilitating, as bad or maybe sometimes worse than rheumatoid arthritis. So that is something that's very serious, and I understand that can be debilitating for a patient. I'm sorry to hear that you're suffering from that, but yes, from a standard approach, methotrexate, sulfasalazine. Methotrexate is trying to turn down your immune system so that it stops attacking your body. Sulfasalazine is modulating the immune system. There's also, in some studies, it looks like that sulfasalazine, yes, has sulfur, and one of the ways it may be affecting is it's actually modulating gut bacteria that could be triggering autoimmune processes, which is another place, not just infections, but yeast or gut dysbiosis, bad bacteria like Citrobacter, Pseudomonas, some other ones that research is coming out and showing, just because you have that doesn't mean you do have an autoimmune disease, but you're at a higher risk for rheumatoid arthritis or some other autoimmune issues. So with that, there are some natural options. She's starting to have brain fog. They would want to make sure whether her folates are sufficient. Methotrexate interferes with the folate pathway, which you need to make your neurotransmitters. And then if you're having brain fog, it may be that not only you're lowering your immune system for the sake of the autoimmune process, but you're affecting how your brain's functioning. And also you need methylation for some detox. So you may not be detoxing as well. We would still go through the same thing, look for triggers, use natural anti-inflammatories, trying to lower the dose. And now I will say, if you came in to see me, I'm not going to suddenly pull off all your pharmaceutical meds. I'm going to say, let's put some natural therapies in beside them and see if we can start backing off. Once you say, oh, you're feeling better, let's back off. I have a patient with Crohn's I talked to today just about the fact that we've gotten down to where he's only needing Remicade every 10 weeks instead of 8 for his Crohn's disease, and it's actually gaining weight, doing much better. So we're going to back those things off. We might look at using another pharmaceutical, say like low-dose naltrexone, which is an immune suppressant in a good way that helps modulate and a lot of patients find that they can lower the dose of steroids, lower the dose of other autoimmune diseases, and get better. So yes, there are things to do, but it is a slow process. that we are trying to recover damage in patients that may have occurred over a year, 5, 10, 20 years in cases. So the next question, though, let's move on just to make sure we're staying good time since we've got a lot of questions. I don't want to leave any more out than I have to. Let me do this. We're about almost halfway through. Just to mention, again, I can't diagnose, I can't treat over this kind of medium. I want to educate. I want to make you aware that there are other options besides what conventional medicine has to offer. There are other options that can help you with your autoimmune disease and the inflammation from it. So if you'd like to know more, come and see us, the patient. We are glad to try to help, and we are excited about helping patients who have been from one doctor to the next finally find some hope and some answers to their health challenges, their chronic illness. The next question is from Miss Tudor. My daughter, now 17, has been getting recurrent mouth ulcers since around 4 years old. They range in severity but are very painful. We've been to specialists and tested for everything, all were negative. They did discover that her white cell counts are lower when they occur, and ulcers will appear during sickness, stress, or infection. So, first question is, could this be autoimmune? Yes. But, do we know for sure? Well, obviously I don't know the whole story. Hopefully they look for vitamin deficiencies, B vitamins. There's some others that could potentially be causing sores in the mouth. There's also some genetic diseases where people have some issues where they recurrent ulcers. But looking for chronic viral infections like Epstein Barr, yes, would be a good thing. Looking for toxicities, whether mold toxicity could be suppressing the immune system, especially when you see that white count that was mentioned being low. It could be that there's something more going on there than, well, you're just going to have ulcers, great. Well, yeah, the fact that whenever she gets sick, inflammation goes up, there may be a little bit more there. So there are other rocks to look under when you're searching for answers than what conventional medicine is willing to look at. And it could be food triggers. It could be the fact that you do testing and find out that she has IgE or more like IgG antibodies to, say, nuts. And if you cut those out, she actually doesn't get those anymore. So that's just an example. You would need to do testing to know that, or consider a food elimination trial, cut out different foods over a few months to see if that occurs again. So those are some of the things, and then there's some topical therapies you could do as far as potentially helping those heal up, using a little bicarb paste when those are occurring, making sure you're avoiding acidic foods like tomatoes, spicy foods when they're occurring will help them heal up a little faster. Next question. So our 9-year-old grandson, and this is from Miss Berger in Franklin. 9-year-old grandson just got diagnosed with type 1 diabetes. Understand this is an autoimmune disease and hereditary. Since this is an autoimmune disease, if there's any research that shows he can be treated through diet or other natural ways in addition to insulin shots, or a way to cut back on multiple daily shots. Also, is medical science getting anywhere close to a cure? I'll say, I notice kids today are just terrible picky eaters and all the wrong food and not enough of the good foods. Grandson is one of those terrible eaters, eats foods that are high in bad carbs, won't eat veggies, will eat some fruit. Diagnosis is going to require a huge lifestyle change, going to have to radically change his diet. Besides this change in diet, there are other proactive things they can do to help improve his health through diet and other alternative methods. So yes, so first of all, type 1 diabetes is an autoimmune disease. Basically, you're attacking the islet cells, the cells that make insulin in the pancreas, get attacked. You need those to respond when you eat food. It triggers insulin release. Insulin goes in, glucose goes in, helps the insulin get into your cells. If you don't have insulin, glucose floats around your blood, causes problems. Your cells are tired because they don't have glucose. So you feel sick all around despite having plenty of sugar in your blood. So with that, in that new diagnosis, yes, it's an autoimmune disease. There are things that looking for the triggers now. Is it a trigger that's happened and we can't go back and fix it? Or is it a trigger that's ongoing? So, for example, there are studies showing that gluten, cutting gluten out, can actually improve some of the, lower the insulin needs for patients. I'll say for my son who has diabetes, that did work. We noticed a huge difference in that. Did not was not able to completely come off of that, but we are gluten-free because of that, because he did test for antibodies to gluten. You may look for other past infections and see, okay, if we get rid of this, will that improve? You definitely want to help lower any inflammation in the body, whether that's coming in terms of food. So if someone's eating a lot of processed foods, preservatives, dyes, food additives, kind of things, that's going to increase high fructose corn syrup. Inflammation will worsen that. So you'll see blood sugars go up when someone has an infection. They'll also go up more when you're eating inflammatory foods with trans fats. So there does need to be a lot of dietary changes. There are studies showing that insulin needs diabetic patients do better on a low-carb diet. That doesn't necessarily have to be a zero-carb diet, but that is one option. But also some patients genetically, we talked about genetics earlier, I do have patients who have tried a ketogenic or the low-carb diet, but feel terrible. Not just because they don't have diabetes, but genetically they don't have the ability to process their fats as well. So I do take care with recommending diets. Beyond a low inflammatory diet, it needs to be a little personalized after that. But in terms of the type 1, there are things you can do to help lower insulin resistance. One, exercise. Being active at least every 24 to 48 hours helps your muscle cells pull more glucose in so your sugar does not go up as high. So that's a great benefit that anybody can do that's physically able. The other thing, you can look at things like alpha lipoic acid in the right dose can protect nerve cells in diabetics. Using things like curcumin can lower inflammation if it's there. Berberin, not bourbon, but berberin. Make sure I get that right with patients. I do have some twinkles in the eyes sometimes when I say that, but berberin, which is an herb that you can use to actually improve insulin resistance. It's a little more helpful in the type 2 diabetics, but it can help in the type 1 diabetics as well. So it does take a lot of lifestyle change. There are some natural options out there that can really help, but you know, again, walking through the process of looking for triggers, trying to see early enough, is there a way to stop further damage? Because they are working from a conventional side on being able to take islet cells. Originally we thought that the islet cells were pretty much destroyed after a year or two of having diabetes, but it turns out there's probably a few left in the pancreas even years later. So if they can pull those out of the pancreas with a surgery, it's not an easy surgery, grow those using stem cell technology and reimplant your same, so it's already cells, if they can turn off the autoimmune process, put back those islet cells, you could potentially start over and have functioning islet cells and cure diabetes. So meanwhile, we're looking at things like the insulin pumps, closed loop, where they will test, the machine will test your blood sugar and then control your blood sugar insulin rate based on that test. So those are some of the mechanical things we're doing, but the goal would be to try to regenerate the pancreas. But first you've got to turn off that autoimmune process, and that's where we're hoping to see some further success. So I'm going to, there's a question that came in on the live right now. So from Erica, I've read some about autism being linked to autoimmunity and Candida, or Canada, depending on where you're from. You can say that both ways, overgrowth. Love to hear thoughts on that. So, autism, if you're in the autism community, you've heard this. If you've met one person with autism, you've met one person with autism. Most likely the reason we don't find one single cause is because I really believe there are many more causes than just one. Some are due to toxins, some are due to infections, some are due to nutritional imbalances, some are due a little more to genetics. So there's a lot of different reasons. So autoimmunity is definitely a possibility. Also, a lot of the children who have autism have other immune system dysfunctions that then eventually could make them more prone to suffer autoimmune diseases, whether it's PANS or PANDAS, where your body's antibodies, or immune system's antibodies, are attacking brain tissue. So those are other issues that we could talk about another time. But Candida or Candida is something that produces chemicals that can cause a worsening of autism at the very least, as it produces things like aldehyde and even alcohol. There are yeast, autointoxication syndromes, where patients who have yeast that auto brewery, that if they eat sugar, they have a blood alcohol level go up. But in this case, for children with autism, they often have a lot of gut issues where if they're eating a lot of sugar, overgrowth of Candida in their gut could cause them to have worsening of symptoms. Whether it's the only cause, I won't say that, but I do definitely see that it is one of the exacerbating factors for children with autism. So thank you for that question, Erica. I'm going to go on to another question that was sent in earlier from Cruz in Townsend, Georgia. My fingernails will not grow. They stay soft and chipped, have ridges and crack literally all the way down the middle of the nail. Sensitive and discolored, red and white spots. I have to keep the tips filed because they are rough and snag. Do not believe it is a fungus, although my big toes are in bad shape. No, with the fungus which I'm treating. Help. Local docs have no response. Not wanting to address the problem or being clueless. Meanwhile, I've been taking biotin and it's been a whole year. Help. So, whether this is autoimmune, I would probably look more in a nutritional aspect. Zinc, heavy metal toxicity, would look at those things first. However, from an autoimmune standpoint, it could be if that patient also has some Raynaud's syndrome, where they have a clamping down of the blood vessels in their digits of their toes or their fingers. They will have just literally going white and be painful, then come back red if they're not getting good blood flow because there's attacking the blood vessels or attacking the nervous system, controlling the size of blood vessels. It will increase the chance that someone is having damage to their toes, can even get ulcers on the end of their toes, little dead spots where the skin dies because it's not getting enough blood flow. So it's a little hard to go beyond the fact I would want to look at mineral testing, especially for zinc and copper, look for heavy metal testing to see if that patient's suffering from any of those things before I necessarily would jump to thinking about autoimmunity. Next question is from Miss Leach. I have lupus, have flares that cause my skin to itch and burn. It is inflammation. Ibuprofen helps some. Lasts for approximately 2 to 3 months per flare. Using essential oils, which help some. ANA was very high. I was finally diagnosed with lupus. I take Plaquenil. Do you have any suggestions for my symptoms? So, again, it's going back, looking for triggers. Is there something maybe set that off in the first place? Is it something in your diet? Is it toxicity? Is it an infection? So we would look for all those things and see if we can reverse those. And then, again, see if we can wean you off the Plaquenil. It's not a terrible drug, but getting down to where you don't need the immune-suppressing things that then potentially have other side effects. Next question is from Mr. Ramsey. Feel bad, pretty bad shape, no insurance, go to the ER, they shuffle me in and out, have no insurance. They know what is wrong with me, they will not tell me. I'm so scared of getting sued. What am I to do? So this is a very general question, but I did read it, even though it's not directly related to, say, autoimmune, because I don't know anything else about the symptoms this unfortunate gentleman is having. But I can say that a lot of our patients do go back, and they'll even call and say, listen, I'm having these symptoms, it's scary, what do I do? Because I know if I go to the ER, they're just going to look at me, they're going to scratch their head, and they're going to say, oh, here's a medicine, and go ahead and leave. Our patients deal with that. But, again, we are the ones that are telling them, it's not in your head. I told somebody else that this morning, it's not in your head. I've got lab tests that explain your symptoms. I've got a disease process that I believe once we address, you're going to see resolution of those symptoms. So those patients, I tell them, they have to wait. Sometimes our test takes a few weeks to get everything back when we do that, but we often find answers. And we also try, if we don't find answers on the first round, we do try to keep digging until we kind of can find those things that really lie at the root, so we can really do root cause therapy, not just superficial. So I'm sorry to hear that struggle, but I do get our patients go through that all the time dealing with ER issues. Tammy, what autoimmune issues affect the lungs? Already diagnosed with hypothyroidism, but I'm continually getting lung infections that turn into pneumonia. So, as I mentioned earlier, autoimmune disease is really immune dysfunction. You may be attacking your own tissues, but not attacking the bad guys trying to break into your body. So people will get more infections, especially if they're on immune-suppressing drugs, trying to turn down their immunity. So we'd look at, are there other factors? what are the root cause factors, what are the exacerbating factors, and whether that has anything to do with the hypothyroidism, but untreated or inadequately treated thyroid problems can slow down your immune system. So you need a good functioning thyroid and endocrine system in order to have a good immune system. So Virginia, I'll just note, have hypothyroidism, need help. We've worked through, one, getting you diagnosed if there's a trigger we can find, but also whether you're on synthetic thyroid. Maybe you're not getting enough T3. If you're not getting your T3, thyroxine 3, triiodothyroxine, long word, try to get that word out. Try to see what that level is. You may be having plenty of T4, but if it's not converting to T3 because of inflammation or inability to do so, you may be inadequately treated, and it's just a simple change in medicine that all of a sudden you wake up and feel better than you have in years. Another question, so this is a different from Alice, is how do you get POTS? So POTS, for those of you who don't know what that is, it's postural orthostatic tachycardia syndrome. All that big mouthful of a medical term means is that when you stand up, your body, instead of adjusting your blood pressure just so that your blood pressure stays up in your head, your pulse stays up, all of a sudden your blood pressure will drop, your heart rate goes up, you get lightheaded, sometimes even passing out, or have difficulty being upright for any significant amount of time, having a lot of other symptoms along with that. So generally related to something called dysautonomia. That just means your autonomic nervous system, the one that controls your breathing, your blood pressure, your pulse, your gut speed, all these things you don't have to think about. Dysautonomia means it's not working correctly. With POTS, it's not controlling your blood pressure and your heart rate correctly, such that you can have symptoms from it. That can be an autoimmune disease. If you're producing antibodies that attack nerve cells, that can cause that. Now, there are some other hormonal issues, other things besides just an autoimmune issue that can contribute to postural orthostatic tachycardia syndrome. But those are some of the things we walk through, and again, looking for triggers and trying to treat the symptoms as we're trying to treat the triggers. Let's see. So Marianne asked a question, is there any new information on antiphospholipid syndrome? So let's just take a minute. It's still looking for triggers, but antiphospholipid syndrome is when your body is attacking the phospholipids. So these are cell membrane surface fats, fatty acids. So if you're attacking that, you're getting a lot of inflammation because all your cells have some of those. They often show up in certain places. They will be related to infertility, miscarriages. They can cause a number of other things, and they're often present with lupus or other autoimmune connective tissue diseases. So I can't say there's necessarily new information other than we're trying to look for causes and not just say, oh, well, you got it, and take a blood thinner for the rest of your life so you don't get blood clots. So we're going to look for things to try to reverse that. Often with mold toxicity, you can see that reversed. Those will go away along with ANA, the antinuclear antibody. Next one, Debra Lynn Bennett. What can I do with angiosarcoma? So that is a cancer. So with that, that is something that we are going to try to, it's not an autoimmune disease. That's something we don't necessarily take care of. We definitely believe in natural therapies for cancer, but it is not something we're necessarily equipped to do. We can help prevent it. We can help people recover from it after they're treated, but that is something I would defer to someone who does that day in, day out. And there's a lot of good places out there that we can give you names of where they can help more with natural anti-cancer therapies. Let's see, I think that one we answered. So Carol, tingling in feet and toes, don't know what's going on. If you can contact me, that would be great. So, all right, Carol, tingling in the toes, yes, it could be autoimmune, but also I'd probably start by looking at vitamin levels, B6. If you're getting too much pyridoxine B6, you can actually have some neuropathy. If you're not getting enough B12 and folate, you can actually have some neuropathy. Then I would look at whether toxicities like metals are an issue. Mercury, lead can cause neuropathies where it's not an autoimmune attack, it's just your nerve cells are being damaged. So That would be the first place I would start. Now, if you're having other autoimmune symptoms, yes, you might want to include that in the workup because, yes, it could be an autoimmune attack on those nerve cells. So we've got, about another 10 minutes. So Elizabeth, want to know more. Son is very sick, been to 27 doctors. We now see an infectious MD in DC. So we're often that number 20-something doctor that sees a patient. Can I say over time that we find the answer? No. Can I say that we're a genius because we are the ones that do sometimes? No, I'm not going to say that either. Sometimes it's simply because those other doctors have ruled out the first 10 or 20 diseases. We just step back. We look at any possibilities, even if it's a zebra, something rare, or if it's something we have to piece the puzzle, put the pieces of the puzzle together a little differently. We definitely benefit from knowing someone's history of they tried this, 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 and this. And sometimes it's the things that didn't work, like, oh, I wonder genetically the reason you didn't respond well to that therapy was because you have these genetics. With that, we often figure it out and are able to help somebody get answers they haven't before. So, again, I can't guarantee, only God knows all the answers, but I can say that we often help patients find answers after, even if it's been 20. And yes, I do think it's funny sometimes patients who've been to Mayo, who've been to Vanderbilt, who've been to Cleveland Clinic, often come here after not getting answers in those other big institutions. But part of what we're trying to do here at Sanctuary is be outside the system, so we're not having to rush through a 15, 20-minute visit, even a 30-minute visit, especially in those first ones where we spend an hour and a half or sometimes a little bit more to dig into the history, and then another hour and a half to help you understand it as much as you possibly can, whether you have a medical background or not. So we do help a lot of those patients, and I know it's difficult. Part of the reason I got into this in the first place was having a family member who had bounced around. This doctor said, well, it's not endocrine, go see somebody else. It's not ENT, go see somebody else. Oh, well, it's not infection, go see somebody else. And pretty soon you run out of specialists, so then you start recycling the second opinion in endocrine, or the second opinion in whatever it is, or somebody who's super subspecialized, who just does thyroid, doesn't do all endocrine. You keep looking. But we often help patients find those answers. Again, family members what triggered, but I'm thankful that God's used us to get answers for others so they don't have to have that label. It's just all in your head. So from, I'm not sure if this is Edie or Eddie, but I think it's Edie, diagnosed with scleroderma. This is a horrible disease. So again, scleroderma is an autoimmune disease. It's attacking skin, tightening. It basically becomes very debilitating if you can't move joints because the skin is so tight. But what we're looking at is for triggers, lowering inflammation. Is there something to set that apart? Is there something we can do to reverse that? So we don't just give up and say, oh, well, here's an immune suppressant drug, take this for the rest of your life, put up with the side effects, and be well. No, we're going to try to dig further than that. So, all right, actually, because some of these are typed in here twice. Oh, one more. Chronic neck pain, vertebra from C3 to T1 stacked with no cushioning between. Turmeric has not worked. I'd want to make sure that you got the right turmeric. Let's take a moment for that. If you're using regular turmeric, it probably isn't. It's not absorbed very well, and it may not last very long. So you want to make sure you're at least getting liposomal, so you're getting maybe 10 times or more absorption than regular curcumin or turmeric. And you want to consider using some bioperin, which is basically an inhibitor of the breakdown so that it lasts longer. So I've had a number of patients taking regular curcumin or turmeric, switch over to liposomal and be like, wow, that is a world of difference, and they'll never go back. So I would look at that, making sure always the right dose of turmeric. With that, I'd also look at other alternative from CBD oil, topical or oral, also is a great pain relief mechanism. We would only look at other causes of inflammation. Is there something that can lower inflammation? Is there a food trigger? Is there dietary changes that could help? Could omega-3s be beneficial for you? So we would look at those different things. So I've got another question that's come in. Any suggestions for ammonia-lowering alternatives to lactulose, which is messing up digestive tract due to autoimmune cirrhosis? So Cirrhosis basically means that the liver is being attacked, and cirrhosis is the point where it's getting fibrotic, meaning there's scar tissue, and then there's less of the tissue that's functioning. So that can be a problem, and what the patient is asking here, the person's asking is, lactulose is a sugar of sorts that we use that will help patients pull that in and keep their bowel movements going, and get rid of ammonia. Ammonia can back up. Normally your kidneys remove a lot of the nitrogen in the form of urea, but also your liver needs to process that. If the ammonia is backing up, it's a sign that your liver is not doing its detox process. So we would look at some different things, probiotics that could potentially help lower ammonia, making sure that you're doing a low protein diet. They may already have you on that. We would look at the triggers to see if there's ways that we could slow or reverse or stop the process of autoimmune attack on the liver. I've had at least one patient with autoimmune hepatitis who, once they went completely off grains, their ALT and AST liver tests went completely back to normal and have been there without any steroids, even though the GI doctor thought that they need to be on high-dose steroids. Now, went back and tried grains, and yep, the liver test went back up, stopped, and it went away again. So that is an N of 1. I'm not going to guarantee that the next person comes in with autoimmune hepatitis, goes grain-free, and it fixes everything, but I can say I've seen it clearly once without a shadow of a doubt. So with that, we look at reversing triggers, helping boost your detox mechanisms, make sure we're lowering any toxins that might be coming in, improving your detox so you get rid of ones that are there, keeping your bowels regular with probiotics or vitamin C, keeping the ammonia level down. So there's a lot of things that we could do with that. So that's the questions let's see. Oh, actually I have a couple more questions in the last couple of minutes here. Under the stack. People have Epstein Barr. How do you keep it from flaring up or just happen regardless of what you do? So with that, again, low inflammatory diet. Some people have to keep taking lysine, at least a low dose. Some patients will take long-term pharmaceutical like acyclovir or valcyclovir or famciclovir. Those are things that can help suppress that. Also keeping other infections away, boosting the immune system. So there's a lot of different ways to do that. And getting rid of toxicities that might be causing problems. The next question, what do you believe is the connection between fluoroquinolone antibiotics use in autoimmune disease? From Miss Claybrook. So with that, I do have concerns about fluoroquinolones. I'm trying to remember, I don't remember seeing anything specifically about that in autoimmunity, but I can't say that I've read every study on fluoroquinolones. I am concerned about their toxicity more in terms of mitochondrial and also in connective tissue. Some patients can take them without a problem. Other patients can be very sick with a lot of joint inflammation, tendon inflammation, even rupture because their tendons weaken. Others can get mitochondrial toxicity that doesn't always go away, such that their energy-producing system, their organelles in their cells, are dysfunctional because of that. So I don't have a specific connection between that and autoimmune and fluoroquinolones, but just about anything can be a trigger. So if you have some research on that, feel free to share that with us. I'd love to see it. So regardless, we did get through those. We will be doing our next Facebook Live, just checking the date, on a Tuesday, the 20th, since the 22nd will be Thanksgiving, and I don't know about you, but probably not going to be hanging out on Facebook Live on Thanksgiving Day. So on the 20th, we'll be doing that from 11:30 to 12:30 again. We will be talking about MTHFR and other nutrigenomics, how genetics, which we talked a little bit today, but focusing more that day on how those things can affect your health. So until then, we again have some availability for new patients in December, and then going into the new year, we're looking forward to helping more and more patients live healthier, more abundant lives, whether it's with autoimmune disease, understanding the genetics, dealing with gut health, dealing with mold toxicity, metal toxicity, chronic Lyme disease, Really just most things, except we do refer out for any natural cancer therapies, but most everything else we will do our best to guide you in that. And if we need a procedure, we can do IV therapies, but if you need something more like from an ENT or GI doctor, we do have ones that we can send to get those things done. So with that, I look forward to meeting you in the office, and I look forward to those who are coming back for our Facebook Live to share more education with you here in almost 2 weeks on November 20th. Until then, blessings.